Hey, so busy day there, not only in Kent County, but also along the lake shore as more students head back to school. And of course, with that new school year kicking off across West Michigan, doctors are reminding parents that preparing kids for the classroom isn't just about school supplies, it's also about health too.
Holland Hospital's Dr. Benjamin Blackmer, thank you so much for joining us this morning. You're here to talk more about school checkups, what students should be getting really checked out before heading back for the school year. Thank you so much for coming in this morning.
Thank you very much for having me. Yeah, so our big thing right now is we want to make sure that parents are remembering to bring their kids in for those before school checkups or their sports physicals at this time of the year. So it's kind of our big time to make sure vaccines are getting taken care of, all of our screening questions are being done, and we're just kind of staying ahead of the game on that.
Yeah, so if I'm a parent and I don't know where to start, what's my first step? What should I do?
Yeah, so first off, you can go to hollandhospital.org to be able to find what providers are accepting patients or where you can get scheduled in. You can get access at that website as well to be able to schedule those appointments. But the big thing for this is make sure you also touch base with your school of the expectations. Public schools require a little bit more on the vaccination side than some of the private schools or some of the homeschooling, but that's where you can find out what you are required to do for your child.
Yeah. So you talked a little bit too about vaccinations ahead of the school year. Now, state data is starting to show that some of those vaccination rates are slipping, including in Ottawa County. Can you talk about the importance of vaccines, getting those done before the school year, and what the implications might be of this?
Yeah, so a big thing is during COVID, a lot of vaccines started to decline. And the big thing for that is patients just weren't being seen for those routine visits. We were saving those visits for those true sick COVID patients. And ever since then, we've been really playing catch up to get back up to speed. All those kiddos that were born in that 22, 21 range are going to be going to kindergarten and first grade and things of that nature. So we're really playing catch up on that. And we want to stress the importance of getting those vaccines because they are a requirement for most of these school-age kiddos. And we're also just trying to stay on that preventative side because they're also going to be exposing grandparents and great-grandparents to some of those exposures. We are protecting the kiddos as well as our elderly population as well.
Yeah, when I go in for a checkup for this doctor's visit, back to school-wise, what are the sort of things our doctor's going to look at when they're checking up your student?
Yeah, so we have some different age-based exams and questionnaires. When we are younger, we're looking at things like our lead screenings, especially dealing with some of the Flint scenarios on the east side of the state for a little while. We look at our anemia screenings to make sure we don't have any low blood counts, but we also look at things like autism screening. We look at our anxiety, depression, and even ADHD screening. So we have some questionnaires early on in the visit that kind of prompt any questions. We look at milestones and development. We look at our weight and height to make sure we're not pushing over to potentially even an obesity scenario for our kiddos, because we're seeing a lot of that, especially with some of the foods that we have exposures to at this point in time. So we look at that whole picture, and most importantly, we're really trying to establish that visit early on with a provider, so that way the kids get comfortable talking to a provider, that parents are showing the importance of these visits, so that way when they're no longer kiddos, they're still going in for those annual visits and they're seeking that medical care earlier on than waiting.
Yeah, really teaching them to kind of be an advocate for themselves health-wise.
Yeah, absolutely. And kind of talking about shots, everything that goes into general health, even when we're talking about mental health, going back to school. What about things like vision, dental, even just looking at nutrition heading into the school year?
Exactly. This is that stepping stone and that main point of contact where we're screening. We're talking about kiddos asking how often they're brushing their teeth. It's an option to be able to discuss with mom and dad. Are we getting in these dentist visits? We do a screening exam for vision to make sure we're not having any deficits early, because we want those kids to be able to go to those school classrooms and be able to not be set up for failure. We want them to be able to see and not have any issues at those daily classes.
Yeah, we know that checkups are, typically preventative, when it comes to our health. But when we get into the school year, what are some things that we really see among kids? What are some of the sicknesses you guys look out for?
Yeah, so on the vaccine side, we are seeing some whooping cough, and that's something that we can prevent with some of those vaccines. So whooping cough is a big one. Influenza is another big one that we can vaccinate against. COVID is another big one. So those are some of the preventable aspects on that side. With the seasonal change, we're still going to be dealing with some allergens as we go through some of that, and just some of the common colds as well.
Yeah, common colds, some things that kids always, tend to carry home with them
Exactly.
as they get into the school
Exactly.
year. You mentioned allergies. Let me ask you about that. Seasonal allergies ramping up. I know, Rag, we were looking at it this morning, really high.
Yep.
You can hear it in my voice. You can see it in my eyes. I'm on all of my allergy medication right now. When it comes to seasonal allergies, what's your best recommendation for parents that don't know where to start?
Yeah, so best recommendations, obviously going to be talking with your family physician or your pediatrician. Sometimes we need to be able to go to an allergist and things of that nature, but most of it we can start at that point right there. You can also talk with most pharmacists at your local pharmacy about where we start on ages, where we start with kiddos on allergens, and once we're into that later adolescence, what medications are available, such as the Claritin, the Allegra, and Zyrtec, and things of that nature.
Yeah.
Yeah, so when talking about even sickness versus allergies, what are some of the signs that parents can look out for to help their child determine if maybe a sniffle is because of the common cold or if it's just because of all the ragweed?
It's hard to tell.
It really is. You know, both of those situations, you're going to have the runny nose, the congestion, things of that nature. What you're not going to have on the allergens, you're not going to have the fevers. So the fevers is going to be the big push to it. The fussiness and the irritability, unfortunately, you can get that with both sides. So the fever is going to be the big one. The cough, when it becomes very productive, that's something that if it's lasting a couple days, it's worthwhile getting evaluated to make sure we're not having any pneumonia or anything else settling into the lungs.
Yeah. The other thing too with allergies versus, a cold, I feel like both come with symptoms of just fatigue in general. I mean, I feel so tired. It's because of my allergies, obviously, but I mean, that's another thing to look out for to know the difference on too.
Exactly.
Definitely a lot to look out for as we're going into the school year. Now, when we're talking about sicknesses too that maybe kids could pick up at school and bring home, what are some things that parents could talk to their kids about with washing your hands, just making sure that you can try to prevent that disease before it happens?
Yeah, hand hygiene is a big one. Trying to make sure they have their Kleenexes and they're, after they do sneeze, they're washing their hands, or they have a hand sanitizer with them. Those are all some preventable scenarios at that point. But just being aware of it is the biggest point.
Awesome. Yeah, absolutely. It makes a lot of sense just to make sure that everybody's kind of aware of it going into the school year. When we're talking about getting through the school year, I know there's kind of a long road ahead. This is just the beginning of it all. But what are some things that maybe parents could send their kids off to school with? I know you mentioned Kleenex, hand sanitizer. Is there anything else that you think would be important to bring along?
Honestly, those are going to be the big ones at this point in time.
Okay. Anything else that we haven't asked you that you think is important, especially as we get ready to go back to school? We haven't been inside a closed classroom in a long time. What are some recommendations or last thoughts on that?
It's going to be an adjustment, but make sure that you're providing good nutrition for your kids. There's going to be a big importance for them to be able to have success throughout the day. Make sure they're staying hydrated, give them a water bottle. It's cool right now, but we're still at the warmer time of the school year, so staying hydrated. But then otherwise, make sure you're talking to your kids, because anxiety and stress over the school year is another big factor, and we want to make sure we're putting all those stressors and concerns at ease the best of our ability.
Yeah, you mentioned nutrition. I think that's something that, a lot of families don't necessarily, I mean, I'm sure they're thinking about it, but it's not necessarily at the forefront. What are some of the things that nutrition-wise we need to be looking out for too?
Yeah, nutrition-wise, you're looking for those higher protein foods that are going to last a little bit longer. So some scrambled eggs in the morning, some yogurts and things of that nature. What we try to stay away from are those really sugary cereals or just a snack bar that they grab and go type thing. We want something that's going to last in their system a little bit longer. And the big thing is providing healthy snacks throughout the day as well. And that can be things like a cheese stick or a meat stick or some fruit or things of that nature, but trying to stay away from more the processed in a package cereal bars and granola bars and things of that nature aren't always the answer.
Yeah, the other thing you mentioned too, mental health is a huge conversation, stress, anxiety, all of that. Is there anything in some of those checkup questionnaires that you had been mentioning, anything sort of along those lines too that they kind of check for when you go in for your checkup?
Yeah, so these screenings, they're a standardized screening that every kid's going to get the same questions, and so it provides us a little bit more of an objective way to look at some of those concerns. The big part is the parents and the kiddos are both going to be questions on this. We want to make sure that parents, if they're seeing a concern or a worry that maybe the kiddo is not quite aware of, or the child, we ask some questions with them without mom and dad, so that way we can try to see if there's something that they don't want to talk about in front of them, or make sure that their concerns are being addressed in that way. But those objective screenings also allow us to kind of be aware that there might be something on the inside that we're not seeing necessarily manifested at this point in time yet.
Yeah, okay. And if we're a parent and we want to get some more information, maybe with Holland Hospital, where can we go to find that?
HollandHospital.org is our main website to be able to start looking for some of that information, and then you'll be able to see, once again, what providers are available and point you in a direction.
Okay, Dr. Blackmore, always a pleasure. Thank you very much. Thank you so much for coming in and talking about an important subject, especially as so many kids are headed back to school right now.
Thank you.
All right, it's 8:30. We'll be back in a minute.